I'm Monika Jindal. I'm the Associate Program Director for the Family Medicine and Psychiatry residency. I completed my residency in the Family Medicine and Psychiatry residency here at the University of Iowa in 2016. I originally chose combined training because I wanted to provide a broad array of both mental health care in addition to physical health care, particularly working with underserved populations, and I felt best equipped to take care of those populations if I could address both their physical health needs in addition to their mental health needs. Additionally, I think there's a lot of stigma around mental health care, and I think by being able to provide full spectrum mental health care in a primary care setting helps people have increased access by destigmatizing some of that care. And so being able to do that with just me as an individual and be able to navigate some of those systems was advantageous to the type of care that I wanted to be able to provide for patients. I want someone who's certainly interested in combined training and shows kind of an interest in maintaining that. I also want someone who is relatively flexible. There's a lot that goes into combined training, and so I want to make sure that people are willing to and able to adapt to changing things. I want people that are certainly energetic and committed and devoted to this type of work. Let's see. I think people just in general that are again enthusiastic, just because residency can often be a lot and can be a lot in both good ways and bad ways. I mean, in both really positive ways that you get to make some really meaningful connections with colleagues, with certainly fellow residents, with patients. But then there are also some days that are just more challenging, and so I think people that can kind of understand that blend and that balance as well. There are lots of things I like about Iowa City. Just to tell you a little bit about myself, I actually chose to move back to Iowa City about 6 months ago, or at the start of 2020. And as some people may know, completed my training here in 2016. I actually left and worked and lived in Denver for 3 years, and then decided to come back to Iowa City. So I have a lot of reasons that I like Iowa City. Some of the reasons that brought us back included we really like the people in Iowa City. They're really nice, down-to-earth, friendly, and we just really appreciated some of the friendships that we had here. There's a lot to do in Iowa City, which maybe for people who haven't been here don't realize that, but we enjoyed the atmosphere of college football or college sports. We enjoy going, downtown to the pedestrian mall. There are really good restaurants around here. We enjoy going to shows and things like that. And those are all really accessible in Iowa City. And when we were living in a bigger city, sometimes it didn't feel that that was as accessible. Whereas here we can get to those things easily. There's more recreation than maybe intuitive. It's really beautifully green here in the Midwest, and so it's nice to be able to get outside, get out on some of the lakes and go like kayaking or canoeing, and so there's I think a lot to love about Iowa City. We really like the fact that we can have the life that we want to live, do the things that we want to do, and do so in a way that's manageable and affordable. I think my favorite thing about the university, again, comes to the people. That's another reason, I suppose, that I wanted to come back. It was a place where I always felt that I would be supported and that my interests would be cultivated, and I felt that even in residency. I certainly remember kind of having some off-the-wall ideas for the program directors to help pursue some of my interests, and they helped me. Maybe it wasn't the exact way I was seeing it, but they actually could find something often better that would help fulfill requirements. So I think people were able to be really creative to help me accomplish some of my goals, and I find that to still be true even now. I think there are several unique opportunities or several things that set our program apart. I think one of our most unique things is our family medicine and psychiatry clinic. It's a psychiatry clinic that's embedded within a primary care setting that our residents start in their second year and they continue through their fifth year. So they essentially have 4 years of continuity psychiatry in a primary care setting. And I think learning how to navigate something like that at that level is certainly unique to our program. And then getting that experience in continuity psychiatric care. So I think that's one aspect that's definitely unique. I think secondly, kind of in the same vein, is the innovativeness that this department allows for and this program allows for. So I just in the last several weeks started a new integrated behavioral health clinic in the family medicine, the main hospital family medicine clinic. And that's intended to be a short-term consult service or consult clinic for the primary care providers to be able to access a psychiatrist in ideally just a couple of weeks to be able to ask some diagnostic clarification or medication management questions for their patients. And then those patients will ultimately be returned to a primary care setting or set up with longer-term care if that's what's indicated. And so I think, again, that's another unique opportunity for our family medicine residents to participate in, but also kind of gives you a sense of the innovative programs that we're doing within our program and within the department. I think another thing that makes our program unique is actually the amount of combined trained faculty that we have around. I think right now especially we have a good amount of combined trained faculty involved in our program that are also doing really neat projects. And so again, I think that just increases and enhances the exposure to innovative care models that can be done with combined training. Yeah, I think people are really excited about what we do and what we're able to bring to their systems and clinics and settings. I think that they're excited about the ways that we can innovate and bring either mental health care to primary care or even primary care to mental health care.